I'm Bruce Trapnell, Professor of Medicine and Pediatrics at the University of Cincinnati College of Medicine. My interest here is in raising awareness about PAP among physicians, families, and the general public. APAP is a disorder of surfactant accumulation that causes a sense of breathlessness. Well, normally the lung is coated by a thin layer of surfactant, which helps the lung function. In PAP, this material accumulates and fills the air sacs of the lung and prevents oxygen from getting into the blood, thereby causing a sense of breathlessness. Other symptoms include cough, chest congestion, sometimes chest pain. This impacts the patient's everyday lives and in simple things, walking up the steps, dressing, preparing meals, carrying groceries, etc. In the past, APAP has not been possible to be diagnosed. Notwithstanding, a number of procedures are generally done in the workup of a patient with APAP, including lung biopsies. Typically what happens is somebody comes in with shortness of breath, they get a chest x-ray, then it looks bad, right? But the patient doesn't look too bad, which is itself diagnostically useful. Then they get a CT scan, and it's characteristic, but it's not diagnostic. And then they get diagnosed with pneumonia. A couple of courses of antibiotics, 2, 3, 4 courses of antibiotics, with or without some advancement, whatever, but it doesn't go away. And then referral, whatever, diagnosis. None of that has to happen if there's an awareness. One of the really important breakthroughs in this disease was the identification of antibodies to GM-CSF. And we've translated that into a diagnostic, which is a simple blood test, which is convenient and non-invasive and 100% accurate. Having a diagnosis that's specific and clear is helpful in several ways. One is that the patients feel more comfortable knowing what's going on. They have less uncertainty, they're having less procedures, etc. And another aspect is that understanding the specific nature or which disease it is that you have that's causing PAP allows you to choose treatment options that are appropriate for the disease. The beauty of this test is that it's available for routine clinical use by any physician at any time.
For more information about APAP and the various non-invasive diagnostic tools for U.S. patients, please visit apapawareness.initiative.org.